Nurse Aide Prep. Question 1. The nurse aide is assisting with morning care. The client prefers to perform their own care. The aide should: Option A, perform all care for the client. Option B, allow the client to do as much as possible independently. Option C, rush the client so they finish quickly. Option D, leave the room and return when the client is done. The correct answer is option B. Allow the client to do as much as possible independently. Promoting independence is a core principle. The nurse aide should encourage and enable the client to perform as much self-care as possible while providing assistance only where needed. Performing all care undermines the client's abilities and dignity. Question 2. The RACE acronym stands for: Option A, rescue, alarm, contain, extinguish. Option B, run, alert, call, evacuate. Option C, rescue, assess, control, evacuate. Option D, remove, alert, contain, extinguish. The correct answer is option A. Rescue, alarm, contain, extinguish. RACE is the standard fire response protocol. Rescue clients in immediate danger, alarm, pull the fire alarm/notify, contain the fire, close doors, and extinguish, if safe. Question 3. After giving a client a back rub, the nurse aide should always note: Option A, the last time the client had a back rub. Option B, any change in the client's skin. Option C, the client's weight. Option D, the amount of lotion used. The correct answer is option B, any change in the client's skin. The nurse aide should document any skin changes observed during a back rub, such as redness, dryness, or breakdown. This is part of routine skin assessment and helps prevent pressure ulcers. The amount of lotion used, last back rub, and weight are not the primary observations to document. Question 4. A client has difficulty adjusting to a new facility. The nurse aide should: Option A, tell the client they will adjust. Option B, allow the client to express their feelings. Option C, leave the client alone to adjust. Option D, call the family immediately. The correct answer is option B. Allow the client to express their feelings. Allowing expression of feelings helps the client process the transition. Telling them they will adjust, A, is dismissive. Leaving them alone, C, may increase isolation. Calling the family, D, may be appropriate but not the first step. Question 5. A client's oxygen saturation reading on the pulse oximeter is 95%. This is: Option A, below normal. Option B, normal. Option C, above normal. Option D, requires immediate reporting. The correct answer is option B, normal. Normal SpO2 is 95 to 100%. A reading of 95% is at the lower end of normal but is acceptable. Readings below 90% require immediate reporting. Question 6. The Heimlich maneuver should be used when a client: Option A, is coughing forcefully. Option B, cannot speak, cough, or breathe. Option C, has a minor cough. Option D, is having difficulty breathing. The correct answer is option B, cannot speak, cough, or breathe. The Heimlich is for severe airway obstruction when the client cannot speak, cough, or breathe. A client who is coughing forcefully can still breathe. Encourage coughing. Question 7. A client with a history of falls has been repositioned. The nurse aide should also ensure: Option A, the bed is in the highest position. Option B, the room is completely dark. Option C, the bed is in the lowest position and the brakes are locked. Option D, the client's family is called. The correct answer is option C. The bed is in the lowest position and the brakes are locked. The bed should be in the lowest position to reduce fall injury risk, and the brakes must be locked. The room should have adequate lighting. Calling the family is not part of the safety routine. Question 8. A client becomes upset and tearful while discussing their recent diagnosis. The nurse aide should: Option A, change the subject to something more positive. Option B, tell the client to stop crying. Option C, sit with the client and allow them to express their feelings. Option D, leave the room to give the client privacy. The correct answer is option C. Sit with the client and allow them to express their feelings. Allowing the client to express emotions and providing a supportive presence validates their feelings and helps them process difficult information. Changing the subject dismisses their feelings. Telling them to stop crying is insensitive. Question 9. When dressing a client with a weak right arm, the nurse aide should: Option A. Dress the right arm first. Option B. Dress the left arm first. Option C. Dress both arms simultaneously. Option D. Dress the stronger arm first. The correct answer is option B. Dress the left arm first. Dress the stronger arm, left, first, then the weaker arm, right. This minimizes discomfort and strain on the weak arm. Dressing the weak arm first would require moving it more. Question 10. The apical pulse is located at the: Option A. Wrist. Option B. Neck. Option C. Apex of the heart, 5th intercostal space, midclavicular line. Option D. Elbow. The correct answer is option C. Apex of the heart, 5th intercostal space, midclavicular line. The apical pulse is at the point of maximal impulse, PMI, the 5th intercostal space at the midclavicular line on the left chest. The wrist is radial, neck is carotid, elbow is brachial. The apical pulse is counted with a stethoscope. Question 11. When receiving a report at shift change, the nurse aide should: Option A. Ask questions about unclear information. Option B. Write down everything quickly and leave. Option C. Ignore information about client preferences. Option D. Rely on the previous aide's verbal report only. The correct answer is option A. Ask questions about unclear information. Asking questions ensures accurate communication and safe care. Writing everything down without clarification may lead to errors. Ignoring preferences misses important care details. Question 12. A client with a pulse of 112 beats per minute is experiencing: Option A. Normal heart rate. Option B. Bradycardia. Option C. Tachycardia. Option D. Arrhythmia. The correct answer is option C. Tachycardia. A heart rate above 100 beats per minute in an adult is tachycardia. This is above the normal range of 60 to 100. Bradycardia is a rate below 60. Arrhythmia refers to irregular rhythm, not rate. Tachycardia may indicate fever, pain, dehydration, or other conditions requiring reporting. Question 13. Normal adult respiratory rate is: Option A. 8 to 12 breaths per minute. Option B. 12 to 20 breaths per minute. Option C. 16 to 24 breaths per minute. Option D. 20 to 28 breaths per minute. The correct answer is option B. 12 to 20 breaths per minute. The normal adult respiratory rate is 12 to 20 breaths per minute. Rates below 12 indicate bradypnea, above 20 indicate tachypnea. Both require reporting to the nurse. Question 14. What factor is not known to affect vital signs? Option A. Pain. Option B. Age. Option C. Hair color. Option D. Exercise. The correct answer is option C. Hair color. Pain, age, and exercise all affect vital signs. Pain and exercise increase heart rate, respiratory rate, and blood pressure. Age affects normal ranges. Hair color has no physiological effect on vital signs. Question 15. When providing care for a client from a different culture, the nurse aide should: Option A. Follow standard procedures regardless of culture. Option B. Ask the client about their preferences and respect them. Option C. Assume cultural preferences based on the client's appearance. Option D. Ask the nurse to provide care instead. The correct answer is option B. Ask the client about their preferences and respect them. Asking the client about their cultural preferences shows respect and enables culturally competent care. Following standard procedures without regard for culture may be insensitive. Making assumptions based on appearance can lead to stereotypes. Question 16. When a nurse aide is floating to a different unit, they should: Option A. Refuse to float to an unfamiliar unit. Option B. Accept the assignment but only do familiar tasks. Option C, accept the assignment and ask for orientation to the unit. Option D, accept the assignment and perform all tasks independently. The correct answer is option C, accept the assignment and ask for orientation to the unit. Floating is normal, but the aide should request orientation to the new unit. Refusing may be insubordination. Doing only familiar tasks may not meet client needs. Question 17. The family of a dying client is upset. The nurse aide should: Option A, ask the family to leave. Option B, offer support and a private place to talk. Option C, ignore the family. Option D, tell the family everything will be fine. The correct answer is option B, offer support and a private place to talk. Family members need support too. Offering a listening ear and a private place shows compassion. Asking them to leave or ignoring them is insensitive. False reassurance is not helpful. Question 18. An adult client with a respiratory rate of 8 breaths per minute is experiencing: Option A, tachypnea. Option B, bradypnea. Option C, normal breathing. Option D, hyperventilation. The correct answer is option B, bradypnea. Bradypnea is an abnormally slow respiratory rate below 12 breaths per minute in adults. 8 breaths per minute is significantly below normal. This may indicate respiratory depression, sedation, or neurological impairment and requires reporting. Question 19. Standard precautions apply to which bodily fluids? Option A, blood and blood products only. Option B, all body fluids, secretions, and excretions. Option C, only visible blood. Option D, only if the client is diagnosed with an infection. The correct answer is option B, all body fluids, secretions, and excretions. Standard precautions apply to all body fluids, secretions, and excretions, except sweat, regardless of visible blood, treating all clients as potentially infectious. Question 20. Which approach is best when caring for a client with Alzheimer's disease? Option A, use complex medical terminology. Option B, use short, simple sentences and give one instruction at a time. Option C, speak in a loud tone to get the client's attention. Option D, ask open-ended questions. The correct answer is option B, use short, simple sentences and give one instruction at a time. Clients with Alzheimer's have difficulty processing complex information. Short, simple sentences with one instruction at a time are most effective. Complex terminology and open-ended questions overwhelm them. Loud tones are perceived as aggressive. Question 21. The nurse aide should report which finding as a possible sign of abuse? Option A, bruises at different stages of healing. Option B, bruises on the shins. Option C, a client who is hard of hearing. Option D, a client with memory loss. The correct answer is option A, bruises at different stages of healing. Bruises at different stages of healing, varying colors, are a classic sign of abuse. Bruises on shins are common from minor bumps. Hearing loss and memory loss are health conditions, not necessarily signs of abuse. Question 22. What is the correct position for a client receiving oral care to prevent aspiration? Option A, supine position. Option B, Fowler's position. Option C, prone position. Option D, Sims position. The correct answer is option B, Fowler's position. Fowler's position, semi-sitting, prevents aspiration by allowing gravity to aid swallowing. Supine, flat, increases aspiration risk. Prone is not appropriate for oral care. Sims is used for enemas and rectal procedures. Question 23. A client with dementia has incontinence. The nurse aide should: Option A, place the client in adult briefs without offering toileting. Option B, offer toileting at regular intervals. Option C, restrict fluids to reduce incontinence. Option D, ignore the issue. The correct answer is option B, offer toileting at regular intervals. Regular toileting maintains dignity and may prevent incontinence. Restricting fluids can cause dehydration. Ignoring the issue is neglect. Briefs may be necessary but should not replace toileting. Question 24. What is the correct procedure for taking an oral temperature? Option A. Place thermometer under the tongue, close mouth. Option B. Place thermometer under the tongue, breathe through mouth. Option C. Place thermometer between the teeth. Option D. Place thermometer on the tongue. The correct answer is option A. Place thermometer under the tongue, close mouth. The thermometer must be placed in the sublingual pocket with the mouth closed. Breathing through the mouth or placing on the tongue leads to inaccurate readings. Placement between teeth risks breaking the thermometer. Question 25. What does it mean when a client is placed on droplet precautions? Option A. The client must be in a negative pressure room. Option B. The nurse aide must wear an N95 respirator. Option C. The nurse aide must wear a surgical mask within 3 feet of the client. Option D. The client cannot leave the room. The correct answer is option C. The nurse aide must wear a surgical mask within 3 feet of the client. Droplet precautions are used for infections spread by respiratory droplets. These droplets travel up to 3 feet, so a mask is required within that distance. Negative pressure and N95 are for airborne precautions.